And for our final presentation, I'll call up Holistic Wellness Center, Coatesville, PA.
Hello, my name is Shakira Davis, and I want to first thank you for your time and consideration. So I'm suggesting that there be a holistic wellness center here in the city of Coatesville. The idea is a center for community members to engage in preventative health and wellness with access to interdisciplinary resources so that they may live more healthy and fulfilling lives. Oops. So I'm looking to partner with the Equity Center for a physical space for the Wellness Center to be held. I will need approximately $10,000 startup funding for incorporation so that we can become a nonprofit, as well as fiscal sponsors for the Wellness Center for any foreseeable expenses. So here is my why, my family. I am of African American descent, and I've seen how difficult maintaining health and well-being has been for my family. How difficult navigating the healthcare system is, going from one doctor to another, how being on a multitude of pills can have an effect on someone's motivation to want to get out of bed in the morning. I have also seen health issues starting earlier in life in the lives of my peers, being diagnosed with breast cancer, type 2 diabetes, depression, and anxiety in their 20s and 30s. The disparities in health and access to quality health care are clear and have been made clearer after the recent COVID-19 pandemic, which disproportionately affected communities of color. Here are some statistics I found while researching health statistics in the city of Coatesville. This is 2010 U.S. data, so it's a little dated, or U.S. Census data, so it's a little dated, which I'm sure has went up since the 2020 pandemic. As you can see, a large portion of the community is not well. However, despite these health issues within the community, less than $610 out of pocket per person is spent on health care for people that live in the downtown area of Coatesville, with median aggregate cost of medical care for these people being about $12 million, while those living on the outskirts of Coatesville, median aggregate costs are about $50 million. And when you look at the data closely, communities of color and those living in poverty are concentrated in the downtown area, a clear health disparity right here in the city. So the solution is a center for community members to engage in preventative health and wellness with access to interdisciplinary resources so that they may live more healthy and fulfilling lives. The idea is to provide interdisciplinary services to members, excuse me, to members of Coatesville, of the community, that treat the whole person and not just the disease, helping the residents of Coatesville to prevent disease and to give them the education and resources to live healthier lives. We will do this through educational groups like the ones listed above, as well as one-on-one services with members of the center, where we do an evaluation of each person and provide the necessary resources so that they may achieve optimal health. From career coaching to nutritional assessment to therapy and community referrals, the staff will be interdisciplinary, meaning we will hire a range of staff with different specialties, all in health and wellness industry, such as nutritionists, nurses, doulas, Reiki healers, acupuncturists, social workers, etc., to serve the whole person and their needs instead of having them go from one doctor to the next specialist and another to get the help they need. So after this, I would like to secure more funding for the center so that that's not a barrier in the form of grants, loans, and donations. I would like to secure a physical location and staff the center within the first 2 quarters of 2024 and have the center up and running by Q4 of 2024. After year 1, we will evaluate the program to see what is and isn't working and make necessary changes so that we can best serve the community. 2025 and beyond, we hope to grow and develop the program so that we can serve the Coatesville community and potentially other communities. Here's a list of anticipated expenses that we will occur in the startup and operation of the Wellness Center, as well as ways we plan to make revenue from the center. I wish for this center to be a nonprofit organization so that we can serve the community without costs being a barrier for the members of community to have access to the resources that we will provide. So on this slide are just some of the community resources that I wish to partner with to make this wellness center a success. Since I got the call to do this presentation, I have started talking to people in my network that may have something beneficial to offer the wellness center. Me personally, I have had a wellness business for 2+ years, and in that time, I've talked to people about their overall health and well-being, and realized that there is a need for more holistic health care. I have a master's in social work from Westchester University. In my time at Westchester, I studied the city and the community of Coatesville intensely, identifying needs, asking community members for their input, and having an overall desire to assist people on their journey to living their best lives. I was also the recipient of the HRSA grant that focused on training recipients on how to work on interdisciplinary teams to help underserved communities like Coatesville. I've taken a grant writing course and have since received several grants for my current business. I am truly passionate about this project and helping the residents of Coatesville live more happy and healthy lives. Here is my contact information. I want to thank you for your time and consideration.
Okay. Thank you so much, Shakira. Again, hitting on that wellness, that health, the overall person, it's really important and it's very much needed. So I'm just curious, would this be a new organization that you, okay. Okay, all right, well, thank you, good luck.
Thanks, Shakira. I just want to compliment you. You were spot on your stats. It's. I know some of your presenter colleagues had trouble finding Coatesville-specific stats, but you found some stats that were very specific to Coatesville. I think that really speaks to the need. You know your numbers. Kudos to you for that. I think that this is something that we're going to see more and more of in healthcare as the healthcare industry continues to kind of be in turmoil. I don't know if you're aware of, there's an organization actually in Phoenixville, you may be already aware of them, called Project Healing Hive, which is doing some similar things. So good, I'm glad you're familiar with them too, because I'm sure that Kristen would be more than happy to assist you if you haven't already talked with her, but kudos to you.
Thank you.
So really good job. I think that really the thing that's really stood out for me was you really articulated your qualifications well. So for a project to be successful, the leaders got to know what they're doing and be organized. And I think this came across in the presentation, and you're certainly qualified to do this. So I think, and even hitting a little bit more about what your current business does, because it shows that you've really tell a little bit more about that, because it really shows you've been in this space for a while.
Yeah, so I currently have a wellness spa here in Coatesville, located on 4th and Chestnut. So I do more aesthetic services, as well as I have a massage therapist that works for me and another esthetician. However, we're a wellness business, so we're looking not just at people's skin, but what is your lifestyle like? What types of things that are affecting your skin, as that is the largest organ on our bodies, and it often projects what's going on inside. A lot of people deal with pain, so they come in for a massage, and a lot of people look at spa services as like a treat, but it's really something that we need to take care of ourselves. So I'm really in the self-care business. I also teach yoga and meditation out of my location as well.
Okay, and then also, because there are wellness spas around, how is this going to be different? You know, you don't have to answer that right now, but because I know we're on a timeline, but in your presentation, what sets you apart?
Hi, Shakira, thank you. This is a big and great idea, and much needed in the Coatesville community, as well as many other communities in southeastern Pennsylvania and beyond. It is big, so I think that, and I know you're in really early stages, but I think something that would strengthen your presentation as you're going in and asking for money or support is a little bit more on what are the financial needs, scoping that out, even if it's just really like big estimates, but just to give people an idea, because this is big. It's going to take a lot. And I think people need to know, in order to want to commit to you, what is this going to look like?
Certainly, I totally agree. I was thinking about it, and then the number got too big, and I got scared. I'm like, I'm not going to.
It is a big number, but but people need to know that.
Mm-hmm.
So anyway, but good luck to you.
Thank you.
People need to know that you know that.
Yeah.
And thanks again, Shakira. But just speaking to the no, I would be interested to hear your marketing plan. I think consideration needs to be given to that. The fact that you are expanding your wellness, business now to a wellness center, a holistic wellness center. I think there needs to be a real, thought out marketing plan to draw individuals in, those who are experiencing issues in the area of mental health. And also maybe giving consideration to how you address that stigma associated with wellness, and as it pertains more importantly to mental health, especially in the African American community. So, but again, I think it's a great concept, and I wish you all the best.
Thank you.
I agree with all the comments, and thank you for your presentation. One comment that I have is I really appreciate the way how you are envisioning approaching the community that you know is critical here in Coatesville, and it's been a big need for many, many years, the holistic approach, not only about the health of families, but also taking care of everything else. And so good luck and thank you.
Thank you.
Thank you for your presentation. Holistic healthcare is one of my priorities myself. So I can see your vision, absolutely. Wondering what, I saw some of the partnerships on your screen and was excited to see our new NAMI program on there. And wondering what would it look like in terms of partnership with ChessPen and for people to determine sort of when do I go here, when would I come to a place like yours?
So, like I said, we will have one-on-one coaching with people, so we identify their needs, if they need to be referred to, because we might not have everything in the wellness center, but we want people to know where they can go to get the help they need.
Thank you.